Is it clear? Macrosomia can also increase the intrauterine pressure. The fourth one, we have multiple gestation, multiple pregnancy or multiple gestation can be associated with it. And then the fifth one, we have uterine synetia. Is it clear? Or also called Asherman syndrome. So what does it mean? In this case, a woman has done the dilation and curettage in the past in order to stop a past pregnancy. Is it clear? When you were doing abortion in the past, the technique that was done was dilation and curettage. And when you curettage part of the endometrial lining, you're going to have fibrosis, and that fibrosis prevent the uterus from expanding. Is it clear? When there's prevention of uterus expansion, if an increase in intrauterine pressure, we can be associated with premature rupture of membrane. So this is how uterine synetia is associated with even abortion, because this same mechanism of premature rupture of membrane, if you have rupture of membrane before the age of viability, that is 20 weeks gestation, you can either call it a premature, it can either be called a pre-viable rupture of membrane, or it can be called an inevitable abortion. So these are the two terms that you can use. Is it clear? Generally, when you have a pre-viable premature rupture of membrane, it is usually as from 20 weeks of gestation to 20 weeks of gestation. But inevitable abortion is inevitable when the lungs have not even started to mature. Is it clear? And that is even less than 20 weeks of gestation. Is it clear? But all this can be used interchangeably with respect to the context in which you are found. Now, the next one, we have the anything that can result to a reduction in cervical competence. The first one, we have cervical, when you have the case of a cervical incompetence. Is it clear? Cervical incompetence usually occurs as a result of cervical laceration. So that's also another element that can result to cervical laceration or trauma. Is it clear? Now, the third element, if you have a cervical tumor, is it clear? Like cervical cancer and other things. Now, the fifth element is if you have a surgical procedure in order to remove those cervical cancer, like a cervical coning that was done, is it clear, in order to remove the cervical tumor or the cervical intraepithelial neoplasia. If you want to remove those tumors, you can use coning, and that can result in cervical incompetence. The fifth thing, we have a cervicitis. Is it clear? Irritation of the cervix as a result of inflammation, generally by bacteria or any protozoa or any other sexually transmitted infection. Is it clear? So those are the different elements that can be associated with the mechanism of premature rupture of membrane. Now, let's go now to the mechanism that is being associated with the preterm labor. So in the case of preterm labor, is it clear? In the case of preterm labor, we are going to have pathophysiology why we have preterm labor. Generally, we need to know that the pathophysiology can be associated with oxytotics. Is it clear? It can be associated with oxytotics, or it can be associated with oxytotics. Generally, anything that can result to preterm labor occur as a result of the release of the uterotonics. Is it clear? It can be a result of the release of the uterotonics. So the mechanism can be either as a result of increased uterotonics inside the body, or it can be as a result of a reduced progesterone. Is it clear? So those are the different elements. Either it is increased uterotonics or reduced progesterone, because progesterone is an inhibitory mechanism for the uterine contraction. It's either the uterine activity, so it's either the uterine activity is increased, or the uterine contractility, the inhibition of the uterine contraction is reduced. Is it clear? So those are the two major mechanisms. Is it clear? So why we can have preterm labor. So now let's visualize, and this same mechanism can be associated with the reason why we're going to have abortion. So I'm going to explain you later on what are the etiologies of abortion. So now, for the uterine actions, for increased uterine action with uterotonics, in this case, we can have iatrogenic conditions, iatrogenic conditions, which can be associated with giving a patient any uterotonic. Is it clear? So like misoprostol can be given to the patient, like a iatrogenic condition, misoprostol can be given to a patient to induce abortion. Oxytocin can be given to a patient, and generally you need to know that oxytocin is going to act on the uterus. Oxytocin act on the uterus generally after 20 weeks of gestation. Before 20 weeks of gestation, it's better to give methyl ergometrin. So when you have a patient at less than 20 weeks of gestation and he has taken that, it can be a cause of preterm labor. So the cause of preterm labor can be iatrogenic. It can be associated with an increased uterine activity. Now, the second cause we can have, so this is associated with iatrogenic increased uterine activity. We can have also etiologies of prostaglandin secretion, basically, and generally you can have prostaglandin secreted as a result of prostaglandin can be secreted as a result of fever, infection. Generally, that is the most common etiology why you have a preterm labor. Infection. Infection is going to be associated with inflammatory response, and that inflammatory response is what is going to release the prostaglandins. And you need to know that what among the prostaglandins you have prostaglandin E, G, and F. Is it clear? Now the prostaglandin which is involved with the activation of the uterus is generally prostaglandin E. Is it clear? While the prostaglandin G and F can be the one which is involved with the thermoregulation of the body. Now this prostaglandin E which is involved with the activation of the uterus is going to cause more uterine contraction. Is it clear? And that is going to result to the preterm labor. So that is the major etiology. This is the major etiology why you are going to have preterm labor. Is it clear? This is the major etiology why you have preterm labor. So generally infection which are more prone in patients, you have malaria, you have pregnancy, you have malaria and urinary tract infection. Every time you have a patient that is pregnant, you must first check for these two before now you can go to the other point of focus like pneumonia, you can go to gastrointestinal tract, you can go to the upper respiratory tract and all the like, and even the integumentary system. Now, the mechanism of reduced progesterone or a decrease in inhibitory activity is clear. So, what are the things that can cause the reduction of progesterone? It can still be iatrogenic. Is it clear? Now, other elements which can be associated with the reduction in progesterone is a luteal phase incompetence. You have luteal phase incompetence, but generally, you need to know that what the luteal phase incompetence is more associated in abortion. When you have a first trimester abortion, is it clear? You have more of luteal phase incompetence, and I'm going to speak more about that when we are going to visualize abortion and its risk factor. Is it clear? So from here you have seen the major elements, the major risk factors for premature rupture of membrane and preterm labor. Is it clear? Now we are going to continue now with the clinical presentation by visualizing the mechanism, and we're going to visualize also the clinical presentation of the complication of premature rupture of membrane and all the like. So we say thanks for your kind attention. Please don't forget to like and subscribe for our channel. Sounds with the Thank you.